Well, hello, everybody, and welcome to Parkinson Place. I'm Alex Redmond, and thanks for joining us for Power Hour. Today, we have Dr. Fiona Gupta of Mount Sinai Health Systems. She's joining us to talk about Parkinson's disease, nutrition, exercise, and the latest advancements in medicine with therapy management. We're also joined by Danielle Freed. She's the manager for Abbott Southeast.
I have been in the DBS field for over 10 years. Actually starting out very early on, working very closely with Dr. Gupta, and we're excited to bring this program to you today.
And we are also joined by Chad Davey, and he is our territory manager for Abbott.
Thank you so much for putting this on. This is going to be a great presentation. As you said, I am your local representative. At some point in the slides, my contact information will be there. If anybody has any questions or concerns after this, please feel free to reach out to me, and I'll be happy to make sure I get the answer for you. Thanks again, Alex.
Absolutely. And we will put those slides up after the presentation, and we'll leave it up on the screen for quite some time. I want to tell you just a little bit about Dr. Fiona Gupta, and then she'll tell you more about herself. She is a movement disorders neurologist from New York City, and she's affiliated with multiple hospitals. So welcome, Dr. Gupta.
Hi, thank you so much. It's such a pleasure to be here. And, thank you, Alex, the Parkinson's Place, for all you do. It's really so empowering to speak at a venue like this and really kind of reach out to everyone through education. That's really my philosophy, is the more educated we all are, that's the best way to really live well with Parkinson's disease. As Alex mentioned, I'm a neurologist. I am a movement disorder specialist. I am out of Mount Sinai Medical Center in New York City. And yes, I do go to multiple sites within the Mount Sinai system. So really kind of my goals are running a multidisciplinary clinic. And what that really means is the patient in the center, and then everyone else around the patient to really advocate for them. So, that team approach is something I really pride myself on providing to patients. And my other main area of focus is wellness. So wellness in Parkinson's is a lot about exercise and sleeping well and reducing stress, but a big part of it is diet. That's why, I'm really excited to kind of give this talk today, because it makes such a tremendous difference in terms of, focusing in on the lifestyle modifications that you can make to live well with Parkinson's. Again, I want to also thank Abbott for helping to facilitate this event. It means a lot. And I've worked with Abbott for a very long time now in the deep brain stimulation space, but also, kind of from a nutritional perspective, I think is really, really important. So the fact that they understand the needs of patients and also how to kind of outreach to patients, talking about lifestyle, particularly nutrition, is great. So, Abbott is not just DBS. There's a lot that we don't know about it, that we know that we use every day that, you're not even aware is Abbott, things like Similac and Ensure and Pedialyte and all of those things. Okay. And so, what I do is neuromodulation. That's my main area of focus, treating chronic pain and specifically movement disorders by targeting specific areas of the brain, almost like an electric prescription being delivered to the brain through technology. But beyond just that, I think the portfolio is quite vast with cardiovascular, diabetic care, diagnostics, and so on. So let's talk a little bit about Parkinson's disease. Right now, there's about 1 million to 1.5 million patients in the US that have Parkinson's, about 7 to 10 million patients worldwide. We know that number is going to keep increasing, actually, and that by the year 2030, there may be, over, 2 million patients in the US, and that number is going to continue to grow. And that's really related to a couple different things. People are living longer. There's more options. We have to treat Parkinson's. I think patients are being diagnosed a lot earlier, than just kind of, you have a tremor, you're feeling a little stiff or slow, come back in a year. There's more awareness on earlier diagnosis. And then obviously environmental factors that kind of continue to persist. So, the prevalence of Parkinson's is about 60,000 new cases per year. And again, those numbers are going to continue to increase. So we know that the symptoms of Parkinson's are things like loss of dopamine, substantia nigra degeneration, but there's also other transmitters like acetylcholine, serotonin, norepinephrine, and so on that really account for not just how we move, but how we feel. And so that typically when a patient is diagnosed, the dopamine cells about 60 to 80% of dopaminergic cells have been lost. And that's why I think earlier diagnosis, optimal treatment, really kind of being proactive and aggressive with care makes a bit difference. So that's kind of the key hallmark of Parkinson's, is trying to regulate the dopamine kind of imbalance, as well as other transmitters. And so, we all know Parkinson's is a motor condition. So you get akinesia or bradykinesia, which is essentially loss of or slowness of movement. There's things like a tremor, but not all patients have to have tremor to have Parkinson's. I think there's sometimes a lot of confusion about that, and an increase in tone, which is called cogwheeling rigidity. But again, it's so important to realize there's no two people that are alike. Everyone presents very differently, and it's not just motor symptoms, but it's like the non-motor spectrum. So by the time someone's actually diagnosed, there's what we call premotor symptoms, which are things like loss of smell, sleep issues, a lot of what we call REM behavioral disorder, talking in your sleep, yelling in your sleep, kind of acting out. Constipation is a big one. So it's the slow GI transit that can occur. And so that even prior to diagnosis, there's symptoms that, are important to regulate. And then by the time someone's diagnosed, again, there's the slowness, rigidity, tremors that can occur. And then obviously psychological, mood, and cognitive symptoms as some of the non-motor features. And so again, the key really is not just medication. A lot of patients think, okay, I have Parkinson's, just, I could take medicine and that's it. Absolutely not. It's all about lifestyle first. With then, looking at like a piece of the pie. So lifestyle has to be there, diet and exercise. The meds are a part of that puzzle, but then, advanced therapies like deep brain stimulation are absolutely parts of that puzzle. So in terms of, again, every patient is very different. And the key here, though, is not necessarily just medication or advanced therapy. It's really trying to encourage that diet and exercise. Exercise is really the only thing we know that will slow the progression of Parkinson's. So it's really important, as well as diet. I mean, what you eat, how you eat, when, timing of meds, things like that, they do have an impact on health and comfort. So the role of nutrition, so we do know that there's a significant kind of conjuncture of Parkinson's and nutrition, and patients are really encouraged to think about what they're eating. I ask all my patients about their diet. I think it's very, very important, and it's important to realize that Parkinson's can cause things like constipation, bone thinning, even some swallowing difficulties, and then nutrition can also counteract with Parkinson's with regards to med interactions, dehydration, sometimes weight loss. So the key really is a balanced nutritional approach, maintaining muscle mass, and really kind of promoting antioxidation, lessening neuroinflammation, and promoting like cellular repair. And that can be done through, diet, as well as some vitamins and minerals. So constipation, as I mentioned earlier, it's actually one of the premotor symptoms. So it can be present throughout the spectrum of Parkinson's, but we do see it earlier on, even before a diagnosis. It's prevalent. It's about 80–90% of the patients with Parkinson's will have constipation. And not just constipation where, there's a reduction in bowel movements, but also what we call gastroparesis, where there's a lot of slowing of the GI system. That's significant in that, when a patient takes their medication, what used to be absorbed in about 15 to 20 minutes to kick in sometimes takes hours, because we're waiting for the pill to actually be absorbed. So that's why it's not just constipation, but a slow GI transit. And we encourage our patients, to have adequate fiber intake, especially because it helps with fluids while moving through the bowel. But again, it's not just fiber, it's fluids, water. So fiber is not going to work unless, there's adequate hydration. So part of nutrition in Parkinson's is very much hydration as well. And then bone health, not just women, but men as well are at risk for bone thinning if you have Parkinson's. And that can be an issue because it's caused by, if you have a fall or if you have, any type of injury, healing is much, much more difficult. And we know that the likelihood of falls does increase as the Parkinson's advance. So taking, good control of bone health, especially, supplementing with foods that have calcium, magnesium, vitamins D3 and K are really important. And again, something to be very mindful of. I try to encourage my patients to go for a bone scan at least once a year so that they have an idea as to where they are in the spectrum of bone health, and then really work at it through diet. And then again, the food and medication interaction is important. So it's not just about taking medication, it's the timing, but it's also the timing with regards to meals. And sometimes, if you take your levodopa too close to like a high protein meal, they can kind of fight each other to get into the brain, and protein usually wins, so that dose is kind of what we call a dose failure. The levodopa just doesn't get absorbed. But we don't, I have a lot of patients who will say, well, I'll just stop eating protein. And that's not the solution, because you really do still need amino acids, which are the building blocks of protein and for brain health. And you also want to maintain, protein intake, especially for, muscle mass. You don't want to lose muscle mass, because that can lead to, again, worsening motor symptoms, falls, and things like that. So the key really is, helping with the absorption of levodopa. Sometimes we have meals timed out. I always say about 30 minutes before or 40 minutes after a meal to take your medication is good, especially if there is kind of a protein effect. But definitely the key is not to avoid altogether, intake of protein. And then the swallowing issues, some patients with Parkinson's have swallowing difficulties. Some don't even realize they have swallowing difficulties and are what we call silently aspirating. So every time they're eating or drinking something, it's actually going into the wrong tube. And essentially that can lead to pneumonia, aspiration pneumonia, which is a very big reason why a lot of patients do end up in the hospital. So again, the key really is picking up at it early. I'm such a big believer in like speech therapy and LSVT therapy, which I'm sure, Alice has lots of good resources for, and really kind of picking up on any swallowing difficulties. If you are having any issues with swallowing, even if just coughing after drinking water or issues with medication, it needs to be brought up, because then we really, go after it in terms of diagnosing, getting the right diagnostic test, and then working with a therapist to really enhance the swallowing mechanism. In certain cases, if there is swallowing dysfunction that's discovered, we recommend certain foods or food preparation, like puree diet type thing. But again, it's imperative to go for a good course of speech or swallowing therapy as well. And then again, dehydration. I think especially in the summer months, we're all very guilty essentially of not drinking enough water. We get busy or things happen, or, but in Parkinson's, it is so crucial to keep up your hydration. Dehydration can lead to what we call orthostatic hypotension, which is, where the brain's not getting blood flow, especially from sitting to standing or lying to sitting. And that can lead to falls, confusion, dizziness. Also dehydration can be very a big risk factor for urinary tract infections and other infections. So the key really is staying hydrated. It's very, very important. So again, I think we've defined, why nutrition is so important and how you can sort of what we can do like going forward to really kind of making sure that we are on the right track. So again, if there is unplanned weight loss, you are at risk for loss of muscle mass and, issues with poor mobility and things like that because of it. So you want to keep up your weight. Many patients with Parkinson's, because they've lost some sense of smell, sometimes have a sense of appetite reduction. The key though is smaller, more frequent meals. It's very hard for a patient with Parkinson's to sit and have one big meal at a time, but smaller, more frequent meals are really the way to go, particularly with high protein foods like eggs, nuts, cheeses. In some cases, patients might need, supplemental shakes, which we'll get into. That's very good too, especially if there is a lot of weight loss. With constipation, as we mentioned, it's fiber and fluids and lots of activity that does help get things moving. Fatigue also, especially if there is issues with swallowing fatigue, getting the right types of food preparations and so on is important. And then again, with dehydration, it has to be addressed, and it's important to stay hydrated or add in electrolytes. And so, the goals of, good nutritional status really is to maintain strength and energy, minimize unplanned weight loss, maintain a good nutritional status, and then overall, what we all strive for, when treating our patients with Parkinson's is just really advocating to improve quality of life. Great. So, I was really pleased again when Abbott kind of started this initiative. I had no clue. These are things I was recommending to patients for a very long time, and I did not even realize Abbott was behind them. But things like the Ensure Strength and Energy that has the balanced nutrition, as we mentioned, the protein is a factor. So patients are not getting enough protein. They're at risk of loss of muscle mass, which is really detrimental. So there's like a protein type supplemental type thing. And then we recommend to patients, especially poor appetite or loss of kind of drive to eat, sometimes the nutritional bars can be very helpful. So, the portfolio again is pretty vast. So there's not just Ensure, but I've learned that there's actually the Plus, and then there's the Enlive. So there's different ways of tackling supplemental shakes. It's not just going to the local pharmacy and picking up, whatever is there. It's really important to be mindful as to what you are taking in terms of supplementation, and really, offer the best one that has the balanced nutritional for you, the calories, but again, the protein, and then looking at the vitamins and minerals. So that's why I kind of recommend the Ensures, is that it has Abbott behind it that really has the science to support, supplementation for a complete and balanced nutrition. And then again, supporting muscle mass, protein is absolutely crucial, especially in some of our patients who are vegan, who may not be getting enough, or have other dietary issues. These are great, the protein or the plant-based protein type supplemental shakes. 30 grams of protein is pretty profound, and that will satisfy the needs for the day, as well as the bars. Again, they're pretty high calorie and easy to take. I think you could probably ask the local Abbott, Chad, the representative, who's terrific, to they do have like certain pamphlets and sometimes some cost savings programs for many of these products, but they are products that I recommend highly. Great. And then again, beyond nutrition, one of my main areas of passion is, again, exercise and really improving exercise. Now, in the community, we have lots of different classes. Some of them are opening up at the Rock Steady Boxing. All these things, big and loud. Anything is good. So exercise is so important. And, no matter what stage anyone is in, really finding the right type of exercise is crucial. Again, part of that, pie is really the medication management. And then again, just to touch on advanced therapy, the reason I went into movement disorders was because of deep brain stimulation and what I saw, the effects were. And this was, oh my goodness, back in almost 20 years ago when I was training. And I still get that feeling every day, when you see a patient with DBS, when you really kind of stabilize the brain circuits to really promote an improvement in quality of life. So it's a really important therapy. And anyone with Parkinson's, should know about it and at least find out if they're a candidate or not, but it's important. So as Parkinson's progresses, we know that, again, because of that lack of dopamine, that deficiency grows, and then controlling the symptoms becomes challenging. The medication may work, may work for 5-6 hours in the beginning, but then that window goes a little lower. And then patients have what we call this fluctuations between on time, which is kind of good functional on time, or off time, which is really where return of symptoms occurs. And then again, as that window gets smaller, patients' on times can be complicated by troublesome dyskinesia, which are, large involuntary movements. And so I always call it a roller coaster, because when you're so unpredictable and when you're kind of fluctuating like that, it's not just good day, bad day. It's always good hour, bad hour. And hence why deep brain stimulation is using neuromodulation, almost like an electric levodopa prescription, that has shown to significantly be better than best medical therapy. So the best medication therapy, DBS, has won out in all realms of science in terms of more on time, reduction of off time. And then most of my patients are able to reduce their meds pretty substantially. So again, a terrific therapy. We're very fortunate to have it. And again, it's for the right person at the right place, right time. So again, what is going on in Parkinson's? Because of this lack of dopamine in the brain, it's just not driving a circuit called the basal ganglia, which is then kind of what tells the body what to do. So patients take a lot of the dopamine, but again, it becomes very unpredictable over time. So deep brain stimulation is stabilizing that circuit without the need to take the medication. It's reversible, it's adjustable, we change it over time. It's a very dynamic process, but I always equate it to almost like an electrical version of dopamine. However, this version does not cause dyskinesia and actually can be, adjusted significantly. So it's a tremendous therapy. And what it is basically a lead that's placed in the brain. The lead is like a size of a piece of hair, a little bit bigger. It's then sending pulses from a stimulator. If you see number 1 there, the in the chest wall, that's implanted in the chest, and that stimulator is sending the pulses into the brain to stabilize the brain signals that are causing the abnormal movements. And again, deep brain stimulation is not just for tremor. It's not just for dyskinesia, but it's used for stiffness and slowness, and it can often help some of the off-period non-motor symptoms as well. So it's really just whatever symptoms respond well to levodopa respond very, very well to deep brain stimulation, which is with all the pitfalls of levodopa therapy. And, the key really is, when is someone a good candidate? So we know that it's really more in that moderate window. When patients start to lose effectiveness from oral therapies, they may need more medication. They have different types of off, whether it's wearing off, a delayed on where the medications are not kicking in, unpredictable offs, or even waking up off. So like really when someone's in that window, we know that if someone's being referred in and they're in that very severe state, they're just not going to do as well. So like one of our biggest initiatives over the past decade was to try to get patients to kind of move in earlier in that treatment window. And we do see like the quality of life improvements are significant when patients are referred in or having the therapy earlier. So it's really about around that 5-year mark, good candidate for surgery, no cognitive impairment. And then again, the symptoms improve with medication, unless someone has tremor that doesn't respond as well to levodopa, it responds very well to deep brain stimulation. And this is kind of the portfolio. I mean, Abbott has really advanced the science significantly with their battery. They have this infinity system. It's recharge free, which I think is great. Patients don't like to sit and recharge their battery, whether it's daily or weekly, just a reminder. Patients get an like a Apple device that they can actually set their programming with. The master programmer is like an iPad, and we kind of work together to sync the stimulation. One thing that's very exciting actually is in the last couple of months, Abbott was the only system approved for virtual programming. So everything I do in the office, I could do at home for the patient being at home, and I'm in my clinic, and we can actually program virtually and remotely. That has revolutionized the care of deep brain stimulation and allowed us to optimize patients much faster than with just conventional kind of in-office programming. And then directional leads just mean that the target of the stimulation, that the stimulation can be kind of directed specifically towards what we call the sweet spot in the brain. You can kind of see here the clinicians kind of activating different segments on the lead. That's kind of the picture. And we're, kind of finding the right spot. So again, DBS is a dynamic process in that we're always going after that sweet spot. What is our best setting? And so it's great in terms of, being as precise as possible. And as I mentioned before, telemedicine and DBS has really kind of revamped the field. Abbott's the first and only FDA approved for true remote programming. So what that is, and I've done hundreds of these so far since we got the approval. What that is basically I'm at my clinic, I have my device in front of me, patients can be at home, they don't have to kind of come in, they can be on their meds. So it's really, much better for a patient, but then we communicate, the patient actually has to activate into my device. So they start the session and then we work together. So it's really terrific in that, again, patient has their controller, which is like an iPod. And then there's the clinician programmer, and basically patient activates the setting. We can see each other, which is really neat, on the programming, and we can really find the best optimal setting. So patient initiates the session, there's a security check, there's a performance review. I then adjust the parameters, and on that camera, I can see the patient walking and moving, and then close out the session. Patient closes out on their end. And it can also be done on their iPhone as well, not just the device. So yeah, I mean, definitely please follow up with Abbott if there's any further questions, particularly on the nutrition or the DBS. And the other thing is, this day and age, I think there's so much going on with movement disorders and Parkinson's in particular that, it's very hard for a general neurologist sometimes to be, they're busy, right? So to really be ahead of the field and really kind of understand the nuances of therapy and especially without any established paradigm on how to treat patients. I think knowledge is key and education is really, really important. And so if you don't have a movement disorder specialist, I think it's sometimes very good to just get, an opinion from one. I mean, you can still stay with your neurologist, but just to kind of have one in the loop or even just getting a second opinion, because it makes a big difference. So abbottparkinsons.com actually is a great resource to find a movement specialist that might be near you.
We have some questions from our members coming up, but before we get started on that, we want to make sure that you guys have an opportunity to go ahead and grab a pen and grab some paper. And I'm going to put up on the screen Chad Davey. He is our Abbott Territory Manager's email. So that's going up on your screen right now. And then we also have Dr. Shri Palavaram, who's a DBS therapy and education expert from Abbott. Dr. Palavaram was unable to join us today because he's working on a case. All right, Dr. Gupta, you talked a little bit about fiber from fruits and vegetables and how that helps with constipation. So how important are they at providing phytochemicals? And some studies find are associated with slowing aging and the progression of PD. How important are they?
Yeah, there is definitely a combination of anti-aging, kind of regenerative medicine and nutrition in Parkinson's. Again, the fiber and the fluids is just so vital for flushing the GI system. We know that there is something called like a leaky gut that can occur in Parkinson's. So like even probiotics can be optimal, but fruits and vegetables are really crucial, really for just overall gut health, which then leads to better brain health.
So what kinds of fiber supplements do you recommend in addition to real food?
Yeah, I mean, supplements are okay, but I say if you can get it in the food, definitely get it in the foods. The fruits, the vegetables, the high fiber, even bran flakes, things like that can be okay. Fiber supplements, some patients do use Metamucil or those types of things that can be helpful. But again, if you can get it in the diet, it's much, much better. And it's just much more natural for the body to process.
We had someone ask about some studies that show some PD patients have low levels of antioxidants, vitamins A, B, C, and E. What about taking antioxidant-rich fruits like blueberries containing anthocyanins or antioxidants and multivitamin supplements?
Yeah, you definitely cannot go wrong with that. I always say the brighter the fruits, the brighter color fruits and vegetables are the ones to go with. Those are the, like what we call like little powerhouses, packed with antioxidants. And yes, there is a lot of understanding of pathology in Parkinson's, that it's not just cell loss, but there's a lot of inflammation, there's a lot of oxidation, oxidative stress, and things like that. So an antioxidant approach is really, really crucial.
So like a rainbow on your plate.
Yes, I like that.
What about electrolytes? Are there any benefits to consuming electrolytes instead of in addition to water?
Yeah, water is probably the most crucial for cerebral perfusion, but electrolyte enhanced water can do it just fine. Sometimes the ones that are like the Gatorade preparations have a lot of sugar, so I would just be mindful of that. But again, water, if you're supplementing enough water, you're also gonna really do well for just your internal electrolytes.
How important are neuroprotective foods like nuts and anti-inflammatory fatty foods like salmon, coconut oil and tuna?
Yeah, so definitely, foods that have vitamin E in them have been shown to be neuroprotective. I like the fish oil. So the fatty wild type, not farm raised, but wild type fish are very, I think, important. Everything in moderation, obviously. But yes, I do think that they're pretty imperative for brain health.
What particular types of food or kinds of food delay the absorption of levodopa, carbidopa oral medications?
So typically protein, and again, bigger than like a fistful of protein. So if someone's going to have like a big piece of chicken breast or a steak, I always say, I don't want you to not be able to consume those, just time it out. Again, about 30 to 40 minutes before or after a meal. But it's really, depending on, the degree of protein in foods and also how much.
All right. We had about 3 questions. Same thing. How long before or after a meal should somebody wait before taking levodopa, carbidopa oral medications?
Yeah, again, about 30 to 40 minutes before or after, especially a high protein meal. But not all patients have to. Some patients can take their meds with food, especially some patients do feel a little bit better if they are having any, GI issues. So again, I would encourage anyone to talk to their provider about that, because again, every patient is so different.
And then there's more questions about water. How much water should one drink on average per day? And is an amount of water too much? Is anything too much?
Yeah, definitely. You can overdo it and then cause issues. So again, that's something to kind of, it depends on your body mass index and again, what the underlying electrolytes are. So I usually will counsel my patients accordingly. But I always say, most patients, when you ask them about hydration, are not drinking enough by any means. Maybe a bottle a day, if that, or just some sips with medication. No, but we really want to be mindful. And then obviously, if there's any urinary issues, time it out more so in the morning and things like that, and not so much at night.
Well, you talked a little bit about, the fist size of protein, but how do protein foods interfere with the absorption of PD oral medications?
Typically levodopa, again, they sort of combat each other to get into the brain because there's that blood-brain barrier. And so that occurs and the levodopa does not get absorbed. And then that's what we call like a dose failure. Then patients are going to be off till the next dose. So it is something, again, to be mindful of.
Well, more than a few members wanted to know if they should consider becoming vegetarian or vegan.
No, I don't necessarily recommend that for brain health. I think it's like more of a personal choice, but even my patients who are vegan or vegetarian can still supplement protein very nicely.
And do we yet understand the effects of sugar intake on cognitive decline and PD?
We're learning a lot more about insulin resistance in PD and just, the toxicity of anti-aging that, insulin resistance does. So like glycosylated sugar just kind of sticks to those neurons and, that can definitely kind of accelerate. So we encourage all of our patients who might have diabetes and Parkinson's, you have to have good control of your blood sugars. And again, prophylactic to try to prevent, the development of, so it does play a role.
Well, here's another one of those questions that more than a few people asked. Is there any amount of wine that would be too much or too detrimental for someone living with PD?
Yeah, again, that's going to be dependent on your patients, the comorbidities. Obviously, yes, it could be too detrimental. There's still debate about, does even the glass of red wine have neuroprotective effects? I'm sort of out, and I think there are some medication interactions you have to be wary of. So again, a question that's more specific to discuss with their specific providers.
All right, so we covered quite a bit about the nutritional aspect of living with PD, but let's talk about exercise because that's touted as one of the best things that you can do for yourself. So how much exercise should someone living with PD participate in? Can you break it down to maybe how many days a week, for how long, and how intensely should you work out?
Yeah, exercise again is the only thing we know that will slow the progression. So it's very important. I've had patients who've had, even kind of in the advanced stages who can still do chair exercises, things like that. The recommendation is about 30 minutes, 5 times a week if you can get it. And it's a mix of some light cardio, strengthening is really great, strength training as well as stretching. So again, that combination approach is really important. A lot of my patients are not sure sort of how to start, where to go to exercise. And in those cases, physical therapy or a community-based program, like I mentioned before for Parkinson's, can be really tremendous.
And you can always send them to parkinsonplace.org because after all, we have everything online for them no matter where they are. So we're happy to help them. When it comes to exercise, is there anything such as exercising too much for someone with PD, or how can they recognize the signs if they've overdone it?
I think it's just a level of fatigue, it's muscle burnout. Yes, you can exercise too much to be detrimental, but again, that's going to be dependent on patients. I have patients who are marathon runners who I don't encourage to stop by any means. But again, I think the key really is, the right level for the right patient.
So you mentioned some things, the cardio and then, the strength training and the stretching, but can you talk specifically about other exercises, including things like swimming, walking, yoga, running, if someone's able to run, strength training, weightlifting, Tai Chi, boxing, spin bike, pedaling for Parkinson's. What do you think?
Sure.
Can you talk about some of those?
Well, I mean, I think what you mentioned are all very good. And again, this is really where, my social worker is terrific and she plays a role with helping patients find the right program. But anything that's going to get a patient moving is excellent. I like the big and loud, that kind of, or pedal for Parkinson's. It's like usually big movements, really specific. I like the rock steady boxing just because I feel like it's not just physical, but there's a cognitive mental kind of sequencing approach there. But all exercise is good exercise.
Can you break down, because a lot of people aren't quite sure about what steady state cardio is, but what about low intensity steady state cardio versus high intensity exercise?
Again, it depends on the patient. There's some theory that like maybe the high intensity interval trainings, like spurts of movement followed by some periods of rest might be good for the brain. But in my personal opinion, it's just depending on kind of the patient's underlying, comorbidities, as well as level of exercise, intensity, things like that. So, I mean, I would probably defer that more to our physical therapist, but I think as a whole, in my mind, it's all good, as long as the patient is finding the right type for them.
And what about things like meditation? Because a lot of people find it difficult to meditate.
You can't be physically well unless you're mentally well. I always say that. So if meditation can help with stress reduction, we know that stress is toxic to the brain. Patients may be making some good levodopa or dopamine on their own, but stress kind of wipes it all out. So yeah, meditation, it's not an easy practice, but if it can be incorporated, I think it can only be beneficial.
More and more lately, we've heard about DBS and telemedicine, because these are things that we are now in that age where people are really undergoing more DBS surgeries, or even if it doesn't apply for someone that may be listening right now, it might apply to one of their friends. And the information that's coming out is just phenomenal. And also with telemedicine, which helps you not have to rush out to that doctor's appointment every 5 minutes. So can you elaborate on how and how often you use the Abbott remote programming platform to help patients with DBS programming?
Sure. No, I'm a big proponent of it. Deep brain stimulation is a process. So it's not just a neurosurgical process, but after the programming is a process. It's not that you find the one best setting and then patients are good and they just come in, once a year. It's really kind of routine follow-ups while we're sort of dialing the programming in, working on the med reduction. And, in a clinic, especially I'm in New York City, we have patients from over 100 miles away. It's not always easy to come in and, oftentimes spouses or caregivers have to take the day out, and it's a whole thing. And also, we can really only accommodate patients maybe every 6 weeks, every 12 weeks. So it's, the schedule. But Abbott remote programming has revolutionized that. I cannot say enough about it. I've done hundreds of cases. And it's just so amenable for patients to be able to do it from their own environment. We can connect through our devices, and everything I can do in the office, I can do through telehealth. So patients are in their own environments, and it's, it's a really, really important thing to have for deep brain stimulation. So it's not just about access, it's about optimization of patients, because what we were seeing before, like it might take 3 to 6 months to find that right setting, I can do much sooner because I can follow with patients much more regularly through remote. So it's really a terrific add-on to an already wonderful therapy.
Do you have a few scenarios or patient stories on how you've used the Abbott remote programming during COVID? Because it's been a very difficult time with the pandemic, so during COVID in particular, how has it helped you?
Yeah, I mean, it's definitely allowed for more access to patients. It's allowed for, patients who, again, are fearful to come in or have underlying comorbidities that make them more prone to risk for infection. It's allowed us to really stay in contact and really be able to still, optimize patients accordingly.
Are you able to easily do both video and programming changes at the same time with DBS patients using this Abbott technology?
Yeah, it's really amazing. So really the assessments that we do in the office, the finger taps, the movements, the gait assessment, I can still do virtually while you're programming a patient. So it's really, it's very dynamic.
How important do you think it is for patients to have access to remote programming technology?
I think it's very important. I think all patients with Abbott should at least be signed up. You never know where you're going to be, that you might have an emergency. You might be in an area where there's no lack of specialists, and so being able to access your provider remotely, I think it's a requisite for any patient undergoing deep brain stimulation now that it's available.
So if a DBS patient had a fall and wanted to check the integrity of their device and they're on vacation, is that kind of what you mean, and needed help with the DBS adjustments, you can do that remotely?
Yeah, absolutely.
It's pretty phenomenal. So if somebody already has a Medtronic DBS system, is there a way for them to benefit from Abbott's remote programming technology?
Exactly. So if they have a Medtronic system, but they get an Abbott battery, it is compatible.
We do have quite a few people that are on with us right now that do live in New York. So you can tell them how to get a hold of you, Dr. Gupta. We love to share information.
That's
so how should they
wonderful.
reach you?
Yeah, so I'm more than happy to give out my information. We're doing also remote, which is great. So even if someone's in New York but not in Manhattan, or even if they are and they wanted to just do an assessment by telehealth, we could definitely do that. But what I really like about my institution is just that level of multidisciplinary care. It's not just me. I have a wonderful team I work with, particularly with regards to like just helping patients find the right resources and really kind of, providing, advocacy for patients. And, again, everything you do, Alex, really is part of that team as well. It's such a crucial part.
All right. Well, we'd like to thank you for an absolutely wonderful, very succinct presentation. And of course, if you'd like to reach out to Danielle Freed, we're going to pop that slide back up there one more time so you can see that. So you grab your pens, and you can also reach Dr. Gupta through Chad Davey or through Shri or through Danielle. And we would like to thank you guys for taking time out of your day. We'd like to thank Dr. Gupta of Mount Sinai, and we'd also like to thank Danielle Freed, Chad Davey, who is your local territory rep, and also Shri, who was unable to join us. We do hope that you guys enjoyed it. There was a lot of great information, something for everybody, diet, exercise, telemedicine, DBS. So lots of great information. Thank you for taking time out of your busy day to join us. We'll see you next time at Parkinson Place.